after the Great Fire that consumed St. Paul's. Now, Dr. Warren had his office in his home. Warren and Genevieve lived in this side of the house. His practice was on this side. Would anybody care to guess which side is more haunted?
I'm going to go with the right.
Yes, very, very good. Now you see this office, he actually did surgery in there. Now imagine yourself getting surgery in the 1800s. And there's scalpels and clamps and knives and bone saws, all kinds of crazy things, and survival was definitely not guaranteed. Standing in the street, probably not a good idea, kids. So anyway, he lost a couple of patients. He probably saved a couple as well. But this is now a guest room. People stay in there. And one of the common complaints of guests is as they are trying to rest, they will hear somebody pacing loudly up and down the hallway. Oh my goodness, you scared me. Now anyway, they would hear somebody pacing up and down the hallway. And if you've ever stayed in a guest house, you can imagine how annoying that would be after a while. So they get up, put on their robe, walk across the room, wrench open the door, only to find there's nothing there. There's nobody walking up and down the hallway. There's nobody to be seen. Well, a lot of people think that maybe it was the doctor worried about his patients. But then there are some that say maybe it was just a patient sticking around hoping for a second opinion. Now, I'm willing to admit this is not one of our most active sites, at least not on the inside. But we do have frequent occurrences on that side of the gate. Notice I'm in here. Now, can I ask you why you chose the spot you're standing in, or is that comfortable, or are you okay there? Is it? Yeah. You're next, by the way. Yeah, you. Is it any reason?
No.
Okay, that's a frequent cold spot right there. One of the things that happens when you experience ghostly activity is a cold spot, typically about 20 degrees lower than the normal temperature. What a welcome relief that would be right now, are you kidding? And sometimes they're stationary and sometimes they move around. But one of the other things that happens is the pokings. Are you comfortable there? No. You.
Oh, me.
Yes. Young lady, what is your name?
Kristen.
Kristen. Did you decide to stand there? Was it just a comfortable place to stop, or? Okay, well, when we first started doing the tour, we told this story. It was kind of a segue onto our next story. And I was talking about Dr. Warren, you see, because he was the one that did the autopsy on Elena de la Hoya, you know, the girl that was married to Count von Possel. So we're telling the story, and the girl standing where Kristen is standing right now goes, "Oh! Something poked me in the butt." And we all look at each other like, "Oh, okay, weirdo," and continue on. Well then, a couple of minutes later, there's another lady, but this time she's about 65 years old and German, barely speaks a lick of English, standing where he's standing, and all of a sudden she was Achtung! It happened to her too. Now these women have never met each other before, and obviously we're not traveling together, but both of them got poked in this area. This is something that's happened 11 times in the past year. Now people can try to say that we have rigged things. We absolutely do not. That would completely defeat the purpose of what we're here to do. But if anybody would like to wander through the poking area before we move on to the next place, this might be your last chance to get poked tonight.